in my DNA, but what can I actually do about it?
So let me answer how you use the information first, and then get to the more technical question about regulation. It is an extraordinary thing that when you have something as broadly powerful as a platform of genetics, it has been remarkable about all kinds of uses that I've seen it been put to in the last 5 years. And it ranges from, on the very sophisticated side, using genomics for more rational drug design, like in the pharmaceutical business, all the way to the other end of the spectrum of so-called recreational genetics. So things like genomic social networking. You have that gene, I have that gene, let's go on a date, if you can believe it. Or things like, is your kid going to be a good athlete like Joe's children, which you can predict, not really, but at the age of 2 or 3. Or celebrity genetic ancestry. Are you related to Oprah Winfrey way back when, or Warren Buffett? Which, as a complete aside, evidently doesn't really get you much given his savage inheritance policies. I was just reading his biography. But, and so you have that incredible range. In the middle, when you think about the medical use of genomics, it can range from only reporting on conditions that you can actually do something about, such as a heart disease or diabetes examples, but there's also a whole subset of genetic conditions that you can't do anything about. Huntington's disease sort of being, the poster child of this space. And when I imagine that you all go home today and tell your friends and family that you heard a panel about genetic testing, the knee-jerk reaction that you'll get is, well, that's a scary kind of testing. It's going to tell me how I'm going to die. There's nothing I can do about it. Why would anyone want to get a test like that? That reaction comes from the kind of genetic testing that was done 20 or 30 years ago. But in the last decade, there's obviously been enormous strides in now being able to test for things that you can do something about. And different companies have different philosophies, as I've just shared with you, about what kind of genetic information they're going to share with you and how you're going to use it, whether it's for your dating life or your medical life. On the regulatory side, the FDA for many decades basically only regulated drugs and devices, and they do not regulate diagnostics. Diagnostics were, in essence, regulated under CMS, a separate branch of the federal government. The FDA is now indicating, and has been for the last couple of years, that they have an interest in regulating diagnostics, but they have not yet given any frameworks or certainty as to specifically how they are going to do it. And it is an area of uncertainty that affects all diagnostics, not just genetic testing. And I think most of us are hoping that we'll continue to see more certainty in that space in the next several years, because it affects everything in terms of how you build a company, how you get it financed, what kind of trials you think about.
Thank you.